Hi, it's Sophie from In the Mess. Today we're going to talk to you about how to do a handover at the end of your shift. So handing over at the end of your shift is really important because it maintains patient safety. You can make sure that the incoming team know all the relevant information about the patients, you can hand over any unfinished tasks, and most importantly, you can get home on time. If you're not sure where the handover happens, ask one of your seniors or the registrars where to go and what time the handover starts. Some handovers are happening in person and some of them are online. If it's online, get logged in plenty of time and make sure you're using a device that has a microphone and a camera that can pick you up. A really good way to be prepared for the handover is about 30 minutes beforehand, make a list of all the things you need to mention to the incoming team. For example, sick patients, jobs, all the relevant information. You want to structure your handover in a way that's going to be really useful for the incoming team so that they get the most relevant information first. It can be useful to let them know exactly which consultant is responsible for looking after the patients in your area. So maybe start with identifying yourself and the area you're covering.
Hello.
The consultant who's on call for your patients.
Hello.
And perhaps a bed status report if that's something your hospital uses. So free beds, expected admissions, that sort of thing. Then you want to hand over your sick patients. When you're handing over sick patients, you want to make sure you use their full name and their date of birth or hospital number so that you've got two relevant points of information so that they can tell people apart. Try not to use bed numbers or room numbers, as patients can get shuffled around at night and this can be really confusing for the night shift if they don't know the patients well, and this might lead to mistakes. You want to give them a little overview of the patient's admission, so either a diagnosis or their clinical symptoms, something like they're having an MI or this person has urosepsis. And it might be useful to give them a bit of background information as well, what treatments they've had so far, that sort of thing. You want to make sure that you've got a plan for the patient, either documented in the notes and give them an idea of where to find this if they need it, and make sure that you've highlighted any escalation plans. Is this patient to be escalated to critical care? Do they have a DNA CPR in situ or not? And are there any additional treatments that need to be considered for this patient? Things like dialysis or escalation of antibiotics in specific patient cohorts. Once you've handed over your sick patients, you can then move on to your urgent tasks. It's worth bearing in mind that particularly on night shift there are fewer people around, and so they might not be able to do all the jobs that the day shift people would be able to do. So only hand over time sensitive things, for example blood tests that need to be taken or x-rays that need to be chased up. It's not really appropriate for the night shift or out of hours staff to be trying to finish off discharge letters or paperwork that hasn't been done during the day. Also, if it's something where you know the patient particularly well, like an update with a family that you've had a lot of contact with, it might be better just doing this job yourself and leaving your colleagues to do the less specific jobs like blood tests that can be done by anyone. In some areas, such as acute medicine and A&E, there's a full changeover of staff and it's pretty much full staffing even at night. And so if you're going to be handing over the care of these patients, make sure you hand over all unfinished tasks so that the patients can progress. Make sure your colleagues have got a chance to ask you questions and check information with you. Sometimes it's really easy to mishear names or numbers, particularly over online systems. So make sure that you've been clear and that they've understood. If you're taking handover, make sure you turn up on time. In fact, I always turn up a little bit early so that I've got a bit of time to get settled in. This is really important because your colleagues are waiting to go home and they don't really want to wait around 10-15 minutes longer than necessary so that they can get away. Take notes of what your colleagues are handing over to you. Make sure that you've got information so that you can refer to it later on, because it's really easy to forget 7 or 8 hours into your shift what was told to you a while ago. Ask questions if you're not sure what's being said. Never be afraid to get people to repeat things if you need it double checked. If it's not clear, check who the senior support is. In a lot of departments there's a really clear structure for who's on call out of hours, but if you're not sure, ask who the senior support is and how to get in touch with them. Finally, remember to get your colleagues to hand over the on-call page or phone so that they don't go home with it, because there's nothing worse than an on-call bleep going off in the middle of the night when you're at home.
This is Tim, Sophie's husband and one of the editors. That's my pager. It goes off in the middle of the night. Don't do it. It's not worth it. Bad idea.
Essentially, handing over is all about being prepared in advance, getting there on time, and having a really clear communication with your colleagues. Don't forget to like and subscribe so you never miss a thing.